I'm Divyah from Group 25. Today I'll be talking about applying circular bandage and also figure of 8 bandage. Let's start with the definition of bandage. What is a bandage? Bandage is a strip material that is used mainly to support and also immobilize a part of the body. Next, I'm going to talk about what are the uses of bandage. For these uses, for easy memorization, I use acronym AIRS. So what does this AIRS acronym stand for? Uses AIRSS. A is for applying pressure. This is to stop any bleeding and also improve venous blood flow. Second, I is to immobilize, as in case of dislocation, like dislocated shoulders or dislocated jaws. And also next is R. R is to retain splints. Retain splints in place. First S in that acronym stands for to support when it comes to fractured bone. And also the second S stands for to secure a dressing in place. So these are the uses of a bandage. Next, I'm going to talk about is types of bandages. So there are 4 different types of bandages. First, I'm going to talk about is triangular bandage. Triangular bandage is actually used on many parts of the body to support and immobilize. Second is crepe bandage. Crepe bandage is type of like woven gauze which has like a stretching quality. And then third, we have gauze and cotton bandage. So these bandage are lightly woven and cotton material. So frequently it is used to retain like dressings of wounds, of fingers, hands, toes, feet, ears, eyes, head. These are the parts that we use gauze and cotton bandage. And then we have the classic adhesive bandage. Adhesive bandage is used to retain dressing, also used for application of pressure in certain area needed. So next we're going to talk about methods of applying bandages. So there are 4 different methods: circular, spiral, reverse spiral, and also figure of 8. So today I will be demonstrating and showing you guys examples explaining more about circular and figure of 8. The other 2 will be shown by my group mates in another video. Before we go into the practical part when it comes to the circular bandage and also the figure of 8 bandage, we must always know the principle and the procedures for applying bandage, as in the main overall principle, which is a repetition for every single technique except for the end part where the type of bandage applying technique is different. But this is general for every single bandage applying sessions and procedures.
Wash hands and wear gloves when necessary. Make sure patient is in a comfortable position and support the body part that needs to be bandaged. Stand in front of the victim or patient, except when applying bandage to head, eye, and ears. Observe circulation by noting pulse, surface temperature, skin color, and sensation. Assess the skin before applying bandage. Make sure bandage roll is firm.
First, let's start with circular turn bandages. So circular turns are usually used to anchor bandages and also to terminate bandages. Here I've inserted a picture to see how does it look like, and let's get started with the practical part and I'll show you guys how do you do a circular turn bandage.
Always start bandaging from the inner to outer aspect. Apply the end of the bandage to the part of body to be bandaged. Encircle the body part a few times, each turn directly covering the previous turn, and secure the end.
I am going to show you guys figure of 8 turn bandage. So the application of this bandage is basically on joint areas such as elbow, ankles, and knees. So why is it used in joint area? Because this figure of 8 bandage technique is mainly, it permits flexibility. So it permits flexibility in joint area without disturbing the dressing. So that's the main pro when it comes to this type of application of bandage. I've inserted a picture down here so you guys can visualize how does it look like.
Begin the bandage with 2 circular turns. Carry the bandage above the joint, around it, and then below, making a figure 8. Continue above and below the joint, overlapping the previous turn by 2/3 the width of the bandage. And then terminate the bandage with 2 circular turns. Once that is done, secure the end appropriately.